Ladies and gentlemen, welcome to Global Health. This is your host, Dr. Selim Sılay, physician, entrepreneur, and venture architect. As a partner of AFROTURK TV and AFROTURK Agro World TV now, we are so excited to bring one of the top specialists, Professor Dr. Didem Şener Dede to you. You know, she is working in one of the largest hospitals in Europe, and we are always talking about very important topics. And she had done an amazing work. We received so many messages from you, especially from our ladies, African ladies, asking about breast cancer awareness. And that's why she's with us. I'm really excited to have her. Professor Dr. Didem Şener Dede, welcome to Global Health.
Hello.
Thank you. You know, I want to understand a little bit about the reality of breast cancer in the world, Turkey and Africa. You're a global leader. You treat almost 300 patients as an institution every day. It's one of the most frequent groups. So tell me, what is the reality of breast cancer in the world, in Turkey, and especially in Africa?
Yes. Breast cancer is the second most common cancer worldwide after lung cancer, but it is the most common cancer in women. It is estimated that approximately 1 in every 8 women around the world may develop breast cancer whole life. Every year, all around the world, approximately more than 2 million women are diagnosed with breast cancer.
Wow, that's a huge number.
Yeah. Yes. Unfortunately, more than 600,000 people are lost every year. In general, rate of newly diagnosed patients is high in developed countries around the world, but the death rates from breast cancer are higher in developing countries. In other words, newly diagnosed cases worldwide are mostly reported from Northern Europe and North America. The rate of deaths from breast cancer is high in African countries.
So probably maybe it's diagnosed maybe late, but we'll get to that. But let's talk first about Turkey, since we're now broadcasting from Ankara. Well, what is the incidence rate of breast cancer in Turkey? And do you think public awareness on this issue is sufficient from your perspective as an expert?
Yes, this is a very well question. Every year, more than 20,000 new breast cancer diagnoses are made in Turkey. Unfortunately, we lose approximately 6,000 patients every year due to the breast cancer.
That's a huge number.
Yes, since cancer is a disease that can be treated with early diagnosis, raising social awareness has been one of the priorities of our health policies. Community-based screening programs for breast cancer have been implemented in our country for many years, such as KETEM. KETEM is a smart example. You know, the rate of early diagnosis is increasing in our country. As a result of active health policies about breast cancer, social awareness have increased about breast cancer in Turkey. But of course, there is more work to be done in the fight against breast cancer in Turkey and in the world.
Absolutely. Clearly, having the KETEMs and diagnosing early made a difference in Turkey, but we have to work together, family physicians, experts, and especially breast cancer specialists and all medical oncologists. We have to work hand in hand to really support our patients. I think you gave an amazing summary about Turkey. What about Africa? How widespread is the breast cancer in there? And has there been an increase in recent years? I'm very curious about that.
Yes. According to Global Candidate data in 2022, more than 1 million new cancer diagnoses are made every year across Africa. Among these cancer types, the most common cancer type is breast cancer in Africa. Others are cervix cancer related with the uterus, and prostate cancer. Therefore, breast cancer is of great importance for the African continent. Nearly 200,000 new breast cancer diagnoses are made every year in Africa. This is a very big number.
It's huge, yeah.
Moreover, considering the deficiencies in the cancer registry system in Africa, Dr. Sılay, it can be estimated that the real number are higher than this.
I see.
It is difficult to estimate the actual number for now, but it is a fact that the incidence of breast cancer is increasing across Africa.
So, from what I understand, of course, you need to diagnose so you can treat. And
Yes.
but I'm trying to understand from an African standpoint why, when you look at the Africans, what are the main reasons why women in Africa often notice the disease at a later stage? Because if we catch it later, unfortunately, we are delayed for the treatment and
Yes.
getting away from cure.
Again, another important point. I think there may be several reasons for this. The first is lack of awareness and knowledge about this kind of disease.
I see.
If a woman does not know about such a disease, she may ignore a lump or a mass she noticed in her breast, or
Absolutely.
waste time waiting for it to heal on its own. Another reason may be to avoid breast examination for cultural reasons. The other reason may be the limitation in accessing health facilities. All these facts cause the death rates to be higher on this continent than in other parts of the world. This shows again how important it is to increase early diagnosis opportunities in Africa.
Absolutely. I think there was even a case where a patient looked into just ChatGPT and then asked its symptoms, and then it took the answer, okay, I don't have to go to the doctor, and then later actually they sued
Yes.
some companies. So absolutely, as soon as you feel any of the symptoms, and like you said beautifully, what to do, self-examination and other things, it is very important to go to an expert as soon as possible.
Yes, actually.
Finally, we have so many wonderful African ladies watching this
Yes.
show. What would be your most important message to the wonderful women in Africa and around the world regarding early detection and awareness of breast cancer?
Breast cancer is a treatable disease if diagnosed early. Self-breast examination is very important for early diagnosis. Every woman should have this examination every month throughout her life. In our country, even if you have no doubts, every woman can apply to health centers to have breast checks. General surgery, gynecology, internal medicine, and the other oncology departments plan mammography and annual clinical breast examination. If you have any doubts, without wasting time, you should go a healthcare unit or a doctor. Breast examination is a routine examination like heart, abdomen, or eye examination, and it is not right to shy away from it. Early diagnosis saves your life. I wish you healthy days and healthy lives.
Thank you so much, Dr. Dede. I think that was a great wish. We got a clear picture from everything you shared. Thank you very much for your valuable
You're welcome.
time.
You're
We're all
welcome.
grateful for your amazing time. We know how busy you are. Thank you very much.
You're welcome, Dr. Sly.
Thank you. Thank you, Dr. Dede. Ladies and gentlemen, I'm so proud to present to you Professor Dr. Didem Şener Dede. She has really put everything on the map in a very concise manner, to the point, about breast cancer and how it affects us and how it is actually captured early and then treated early, including why early diagnosis is so important. So definitely stay safe, definitely make sure you contact your physician, and of course stay tuned to AFROTURK TV with Dr. Yavuz Selim Sulay. Take care and all the best. Bye.